I'm Dr. Shalini, OBG specialist, like obstetrics and gynecology consultant, and also consultant in IVF specialization. So now we are going to discuss what is the right time to get pregnant and right age to get pregnant. So in this, again, we have two sub factors, male and female. So we have to consider both and we have to suggest at what time. So in females, as we like, what happens in females is when an individual is born, when a female baby is born, they have millions of follicles in the ovaries. As age advances, or by the time they were born, there will be only like maybe 3 millions or 2 millions of follicles. And by the time they get puberty, maybe like 11 to 13 years of age, there will be only lakhs of follicles. So every time what happens from 13 years of age, so each time every follicle gets released and egg is released. So in such cases, by the time they reach 35 or 40, all the follicles will be utilized. So from this, what we understand, so the right time is late 20s and early 30s. Maybe 25 to 35 is the right age to get pregnant in a female individual. But the most important, again, to achieve more success or to be fecundity or to increase the success rate for any process or to conceive even naturally also, 25 to 30 is a very good age. And if they don't conceive or if they have any issues, then if they conceive in 30s also, they can conceive naturally, but with certain, maybe like I told, IUI, intrauterine inseminations or IVF or ICSI process. So 25 to 35 is a right age, and right time is generally in females. They can monitor, generally ask, what is the right time of intercourse or like that? They ask every time. So in such cases, we have to see the cycle length. If suppose it is a like 28 days cycle, so last 14 days, last half of the cycle will be constant every time. So 14 days means the 14 days before. So 10 to 14 days, you can tell them this is a very fertile period for the couple to get conception or to conceive. So if they want to still monitor, they can also utilize some LH kits also available recently. If they see two lines, it indicates LH surge is there. That is, egg is about to get released. Those 2 days are very important for them to conceive. Or sometimes they can also monitor their cervical mucus vital. So it is like papery, watery in nature. If they see the mucus, that also indicates it is a ovulation time. So all these tests are to say that whether ovulation is occurring or not and what is the time of this ovulation. This is a fertile period. Generally, on an average, if suppose an individual doesn't know to monitor all these things, we can tell 10 to 15 or 16, 10 to 16 days is the right time for conception of an individual. And in some cases, you can also monitor with the scans. So the individual generally comes for the scans to see whether her egg is getting released or not. So they come on 10th day. We also advise them again 12th day or 14th day. So we advise if egg is released, this is a good time to get pregnant. In such manner, you can monitor the individual on the female. So in a nutshell, generally 25 to 35 is the right age to get pregnant, and right time is 10 to 16 days of her cycle. If it is irregular cycles, we have to make them regular, because in PCOS we see generally they are irregular. In such cases, we can ask them to see monitor like cervical mucus or any pain abdomen. One most important thing is pain abdomen. At the ovulation time, they have some cramping type of pain in the abdomen. So in such situations also they can monitor like this, or they can monitor with the ultrasound that is doing the scans. So we have to find out the right ovulation time, and then we can ask them to participate and chances of getting pregnancy. It is usually 10 to 16 days of a cycle. And now coming to the male. So what is the right time? In males generally, 35, 40 years also the sperm quality will be good, analysis, everything will be good. But what happening in recent era, because of the stress, the count is being decreased. And one most important thing in the post-corona, we saw many cases. We don't know, before the sperm analysis, that is semen count, everything is normal. But in the post-corona era, we are getting many semen analysis reports with decreased amount and decreased quality. So we don't know exact reason, but we have to make them caution that. So that is decreased. So they have to have proper diet, proper nutrition, proper sleep, decrease the stress, take the medications on time. And also they also have some medications for males also. So they should also plan properly. And one more thing is they should stop their addictions. Smoking, alcoholism, everything they should decrease, and also drug addiction, anything, whatever addictions are there, they will decrease the sperm quality. They have to decrease this. And also they have to monitor their sugar levels, very important in males. If they are diabetic, so what happens, there will be, that is, feelings will be decreased in them. So in such cases, they also should monitor their glucose levels. If it is not, they have to make it normal. And we all can also give some medication to improve these qualities in them. So in males, the main thing is they have to reduce all around factors, that is stress factors, they have to decrease, and then they have to take proper diet and proper nutrition, and they can conceive. But even then, 30 is a proper age for even a male to get to conceive, because they will have proper feelings, they will have decreased medical risk factors, so they can give the sample, and they can also semen analysis can also be good, and with some changes in them, they can be better in males. So in a nutshell, 4 or 5 points now: 25 to 35 years of age, either a male or a female, proper diet, proper like weight reduction, and also decreased addictions, and adequate sleep, and this all will increase the quality. And in females, they have to monitor the ovulation time, but generally, if they doesn't know anything, they can go 10 to 16 days is a fertile period where they should participate. And in males, they should also check their testosterone and their sugar levels. So if they monitor, if they do all this, they can conceive. So the right time and right age is all these factors.